This continuing education event is about urinary incontinence, practical tips to manage. The objectives for this lesson are to increase the understanding and awareness of urinary incontinence issues, to know how to educate older adults on self-management of urinary incontinence, to identify 5 strategies to help manage urinary incontinence, and to identify 3 situations where a provider, such as a physician, NP, or PA, should be notified of a problem with urinary incontinence. So what is urinary incontinence? It's also known as accidental bladder leakage. It is an embarrassing problem that affects millions of individuals. Over 25 million adult Americans suffer from some form of urinary incontinence. Incontinence can range from leaking just a few drops of urine to complete emptying of the bladder. Although it's more common in older women, it can affect younger women and men as well. Of the 25 million adult Americans suffering from some form of urinary incontinence, 75 to 80% of these are women, and 20 to 25% are men. For women over age 60, approximately 40% deal with incontinence. It is not a normal part of aging, nor something that individuals should have to live with. So urinary incontinence is not just a medical problem. It can affect emotional, psychological, and social life. People may be embarrassed or may think nothing can be done, so they do not discuss their urinary incontinence with anyone, including healthcare professionals. Many people who have urinary incontinence are afraid to do normal daily activities. They don't want to be too far from a toilet. Urinary incontinence can keep people from enjoying life. So 6 out of 10 agree that it should not have to be put up with. 63% say it's impacted their social life, and 1 in 2 considered it a taboo subject to discuss or just difficult to discuss. 55% said it made them feel frustrated, ashamed, or embarrassed, and 57% agree that people just need to manage the symptoms by using pads. 6 out of 10 agree it's not a normal part of aging. So what are the causes? Many things can cause urinary incontinence. Some causes are drinking alcohol, caffeine, or carbonated soft drinks, using artificial sweeteners that irritate the bladder, or taking heart and blood pressure medications, sedatives, or muscle relaxants. Additional risk factors include age, Caucasian race, higher educational attainment, pregnancy-related factors, especially vaginal births, gynecological factors like over age 60 and a hysterectomy, or urological factors such as a history of frequent UTIs. Further causes of urinary incontinence include GI tract factors, chronic comorbid disease such as diabetes mellitus, higher body mass index, smoking, and functional impairment. Sometimes urinary incontinence is simply due to the aging of the bladder muscles, an enlarged prostate in men or menopause in women, or a brain disorder such as stroke or dementia. There are different types. There's stress incontinence, which occurs when the muscles and tissues around the urethra do not stay closed properly when there's increased pressure or stress in the abdomen, leading to leaking urine. Examples are coughing, sneezing, laughing, or running, which can cause stress incontinence. It's a common reason for incontinence in women, especially those who are obese or having given birth by vaginal delivery. There's also urinary and urgency incontinence. In people with urgency incontinence, also called overactive bladder, there's a sudden, uncontrollable urge to urinate. People may leak urine on the way to the toilet. Common triggers include unlocking the door when returning home, going out in the cold, turning on the faucet, or hand washing. Many people with urgency incontinence also have to go to the bathroom more frequently than most people during the day and or night. Normal frequency is considered to be 8 times per day and once at night, but this depends on how much one drinks and may increase if one drinks more than 64 ounces of fluid in a day. There's also mixed or overflow incontinence. Mixed is people with symptoms of both stress and urgency incontinence, and they're said to have mixed incontinence. Overflow incontinence occurs when the bladder does not empty completely, causing leakage, or when the bladder becomes overly full. It may result in symptoms of either stress or urgency incontinence or both. The 2 most common types of urine leakage in people are stress incontinence and urgency incontinence. So what are some self-management techniques? Many people think there's nothing they can do to decrease or prevent incidents of urinary incontinence. This is simply not true. RNs can educate participants on strategies to manage and provide reassurance for them. It's important to keep in mind the health literacy of the participant. Some people might agree with your education or state that they understand, even if they do not, because they do not want to admit that that they don't understand. Studies have shown that 40 to 80% of the medical information participants are told during office visits is forgotten immediately, and nearly half of the information is retained is incorrect. This is probably true also on a home visit in my choice. To determine and build participants' health literacy, encourage the participant to ask questions. Follow up to learn if they understand self-care instructions and evaluate the need for an additional intervention. Create easy to use and understand written, visual communication tools. Or have the participant teach back to you what they have learned. Here's the teach back method. You use teach back techniques on all persons. You start with the most important message and then focus on 2 to 4 key points. You use very plain language, no medical jargon. Here's an example of what you can do. A lot of times people misunderstand because we use medical terms that are commonly used among health professionals. Here's some general self-management strategies. Women should wipe from the front to the back after using the toilet to keep bacteria from getting into the urethra to avoid bladder infection. This is most important after a bowel movement. Also, urinate after sex. Both women and men should urinate shortly after sex to flush away any bacteria that may have entered the urethra. And wear cotton underwear and loose-fitting clothes. This will allow the air to keep the area around the urethra dry. Tight-fitting jeans and nylon underwear can trap moisture and help bacteria grow. You need to cut back on caffeinated drinks or foods, such as coffee, tea, and chocolate, and most sodas. These drinks can make people urinate more, and limiting alcohol use may also help. And if you smoke, try to quit. Ask your healthcare provider for assistance. If you don't smoke, don't start. And here, there are also some strategies for constipation. You need to avoid constipation as it can make urinary incontinence worse. Eating plenty of high-fiber foods like whole grains, vegetables, and fruits, drinking enough water, and being physically active can help prevent constipation. Try to consume 25 to 30 grams of fiber a day. Use the bathroom more often. These are good strategies for urinating. Try to urinate at least every 3 to 4 hours or before leaving the house. Holding the urine in your bladder for too long can weaken your bladder muscles and make a bladder infection more likely. Take enough time to fully empty the bladder when urinating. Rushing when you urinate may not allow you to fully empty the bladder. If urine stays in the bladder too long, it can make a bladder infection more likely. Be in a relaxed position while urinating to make it easier to empty the bladder. Think about where the bathrooms are before you leave the house to go somewhere. If the need to urinate strikes, then you'll know where to go. Wear an incontinence pad or brief. Also, tinkle before you sprinkle. Sit on the toilet every 2 to 3 hours, even if you do not have to go. And sit on the toilet to urinate. Stand for a few seconds if you cannot go, then sit down again and try to urinate again. Sit on the toilet for a long time to urinate and see if more urine comes out. These are all strategies you can try. There are also pelvic exercises. These are known as Kegel exercises to help hold urine in the bladder. Daily exercises can strengthen these muscles, which can help keep urine from leaking when you sneeze, cough, lift, laugh, or have a sudden urge to urinate. To find the pelvic muscles, tell them to squeeze the muscle that cuts off their urine. They will exercise this muscle. Squeeze the pelvic muscle and hold it for 3 seconds, then release for 3 seconds. Do this 10 times each day, but not while urinating, as this can weaken pelvic floor muscles over time or cause damage to the bladder and kidneys. Also, think about water intake strategies. Manage your fluid intake to 46 ounces of liquid a day. It's sufficient for most people. Drink enough fluids, especially water. Most healthy people should try to drink 6 to 8-ounce glasses of fluid each day. Water is the best fluid for bladder health. Ask your healthcare provider how much fluid is healthy for you. Also, keep a healthy weight. Making healthy food choices and being physically active can help you keep a healthy weight. Be physically active can help you prevent bladder problems as well as constipation. It can also help you keep a healthy weight. It can control your blood sugar and check it regularly if you're a diabetic. High blood sugar can cause people to urinate more often. Also, sometimes we need to prevent incontinence-associated dermatitis. Incontinence is a leading risk factor for skin breakdown known as incontinence-associated dermatitis. IAD is defined as the inflammation of the skin that occurs when urine or stool comes in contact with the perineal or paragenital skin. Not only does IAD cause skin irritation and discomfort, but it's also a major risk factor for pressure injuries. It's often grouped with pressure injuries, but they are not one and the same. IAD works from the outside in, while pressure injuries work from the inside out and should be treated differently. Here's appropriate incontinence care. Keeping the skin dry. Cleansing the skin with a mild cleansing agent to minimize irritation and dryness. Applying a topical moisture barrier to protect the skin against further exposure to urine or feces. Pre-moistened, disposable barrier cloths can be used to cleanse, moisturize, deodorize, and protect the skin after each incontinence episode. Soap and water, which are commonly used for cleanup after an episode, are inadequate for the care and prevention because they strip the skin of natural oils, and most soaps have an alkaline pH, which puts skin at risk for secondary infections with fungus and bacteria. So when should a participant notify a provider? If urinary incontinence does not improve, it's time to talk to a provider. They may be able to help figure out why it's occurring. If the leaking continues to worsen over time, despite practicing these self-management strategies discussed in this lesson, or if the participant has painful or burning urination, or if urine appears blood-tinged, or if they have severe back pain around the kidney area. If the participant has any skin breakdown in the genital area due to the constant moisture from urinary incontinence, the provider should be notified. Or if the incontinence is negatively affecting quality of life. or if the participant has any questions regarding urinary incontinence that cannot be answered during a home visit. Remember, the participant is probably embarrassed about their condition and will not want to seek help for it, so educate and reassure them. The participant should report to the provider when the leaking started, if it's worsened or improved over time, and what makes it worse, coughing, sneezing, or does it occur without warning? If the participant has tried any treatments to reduce leakage, it should also be reported to the provider. What current medications the participant is taking, if they have painful or burning urination, if they wake up at night to urinate, or if they're leaking at night while they sleep, or if they take any diuretics such as coffee, alcohol, or prescribed medications, it all should be reported to the provider. Treatment options to prevent bladder and help with bladder control and dribbling should be discussed with the provider. PT, lifestyle changes, bladder retraining, or medications that might be able to help with leaking can be used. The PT is a certified in female bladder incontinence is most helpful, and providers can make a referral. Pelvic muscle exercises could help, and any other symptoms the participant may have, such as constipation, should be discussed. How bladder control and dribbling affects quality of life are very important. There are also support groups available that focus on bladder incontinence. It helps to know you're not the only one with this problem. So what about medication use? There are alpha blockers in men with the urge to overflow incontinence. These medications relax the bladder neck muscles and muscle fibers in the prostate and make it easier to empty the bladder. Examples include Flomax, Uraxo, Rapaflo, and Cardera. Side effects, though, include dizziness, drowsiness, runny nose, nausea and vomiting, abnormal ejaculation and blurred vision, and lower blood pressure. There's also topical estrogen. For women, applying low-dose topical estrogen in the form of a vaginal cream or ring or patch may help tone and rejuvenate tissue in the urethra and vaginal areas. There's an increased risk of endometrial cancer in women with a uterus who use unopposed estrogens. Adding a progesterone to estrogen therapy has shown to reduce the risk of endometrial hyperplasia, which may be a precursor to endometrial cancer. Be aware of this when seeing participants and ask if they have had a hysterectomy. Side effects of using topical estrogen include unusual vaginal bleeding, breast tenderness, headache, nausea, vomiting, and thinning of hair. There are also anticholinergics. These medications can calm an overactive bladder and may be helpful for urge incontinence. Examples include Diptropan, Detrol, Anablux, Toviaz, Vesicare, and Sanctura. Side effects of these drugs include dry mouth, eyes, and nose, drowsiness, blurred vision, nausea and vomiting, and a headache. Evidence has shown significant associations between anticholinergic medication use and increased use of cognitive impairment and dementia. It's important to be aware of this if you have a participant on these types of medications. There's also Myrbetriq. It's used to treat urge incontinence. This medication relaxes the bladder muscle and can increase the amount of urine the bladder can hold. It may also increase the amount your ability to urinate at one time, helping to empty the bladder more completely. Side effects include increased blood pressure, urinary retention, and angioedema. So in summary, remember, urinary incontinence affects both men and women of all ages, but is most common in women over the age of 60. It is not a normal part of aging or something that individuals should have to live with. There are strategies participants can use to decrease or eliminate urinary incontinence. Assess their health literacy and use the teach-back method when educating participants. Many people are embarrassed by their urinary incontinence. Approach the topic sensitively and reassure them that there are things that can be done to help them. And always encourage the participant to see a provider about their urinary incontinence if needed. So, urinary incontinence affects many people in the My Choice program. For more information, there are several websites that have high-quality, evidence-based information regarding urinary incontinence. And here are the references for this continuing education event. Thank you so much.